diagnosed because of the symptoms, but then
Right.
how do you confirm it?
It's the signs and symptoms, is how you present what the things that you say that are happening, and also your exam findings, what the neurologist or the emergency room physician can do with his hands and his brain. So that's all you need.
That's all you need.
That's all you need to diagnose
No,
a
there's
stroke.
no imaging that needs to be done, or
So you
evasive
do
tests?
need to do imaging to further differentiate whether this is that 87% we talked about where there's a lack of blood flow to the area of the brain, or you're on that 13% where there's some kind of bleeding.
So
Right.
talk to me about this medication. Is it new medication? How does it work?
Well, it's not necessarily new. It was approved in 1995, for the treatment of stroke. And as time has gone by, there's been more development on the systems of care to be able to capture the patient, triage them appropriately, and give them medication fast.
And we heard it in the video that we saw that there's a 3-hour window. Why is there a 3-hour window? Why is it so tight?
So we can give TPA now up to 4.5 hours from when the symptoms started. And it goes back to the concept that the brain doesn't sustain too long without oxygen. It's holding your breath underneath the water. How long can you do that before suffocating? And that's what it goes back to. That's why the time is important. However, there's a specific group of, or a subset of the strokes that are caused by a large clot. So if you have a larger clot, those patients can actually benefit from a procedure we call endovascular treatment, where the neurosurgeon or neurointerventionalist can go through the artery from the groin all the way up to the brain and remove,
Follow the path all the way up.
follow all the branches
Right.
all the way up to the brain and remove the clot mechanically with a wire. Now, those patients, we know there's a group of them that can sustain out to 24 hours even. Before the injury is irreversible, and even if you open up the artery, the damage is done. So there's some people that can get benefit longer. However, you don't know where you are. You don't know what type of stroke you had, if it was the small vessel kind or if it was the large clot kind. And the sooner you get the treatment, the better the chances of preventing damage and therefore recovery and outcome.